So you're suffering with sinus pain, you have sinusitis or nasal polyps, and you visited your doctor. They've assessed you and they've prescribed you a steroid nasal spray like this, but you don't know what to do with it or how to use it. Well, don't worry, because you've come to the right place. My name's Dr. O'Donovan, and in this video we're going to cover a step-by-step practical demonstration of how to use it, plus the following useful points which I've split into chapters. So first of all, what is a steroid nasal spray and what is it used for? Well, steroid nasal sprays help to relieve inflammation or swelling and irritation of the nose, sneezing, itching and blocked or runny noses, which are the symptoms of underlying conditions like hay fever, sinusitis and nasal polyps, which are small growths in the lining of the nose. Now, before using a steroid nasal spray, there are some important things that I think you should know. First, always follow your health provider's specific instructions. They're going to specify how long you should use it for, as well as the reason that you're using it. Now, whilst most people tolerate steroid sprays well, generally speaking, you shouldn't use it if you've got an allergy to steroid nasal sprays, you have an untreated infection inside the nose, and that's because this can sometimes worsen the infection, or if you've recently had an operation or injury to your nose. Again, your health provider will advise you if it's appropriate for you to use in these circumstances. It's also important to talk to your health provider if you've ever had tuberculosis, if you're taking another steroid medication, so for example a steroid tablet, or if you have cystic fibrosis. Another important point is that if your child is taking steroid nasal sprays for a long period of time, it can potentially affect their height. If this is the case, it's important that their height is monitored, and you can discuss this with your health provider before they start taking the spray. Finally, it's important that you contact your health provider if you experience any blurred vision or other changes in your vision whilst taking this medication. So now we know what steroid nasal sprays are and some important things that you should be aware of before using them. Well, how do you use it? Well, for this section of the video, I'm going to take you through a practical step-by-step demonstration where I demonstrate this on myself. First, take the medication out of the box and read the information leaflet fully before using it. Every spray is different and will have slightly different instructions. If you're unsure about anything, you can speak to your pharmacist first. So first of all, take the dispensing bottle out of the pack. Shake the bottle a couple of times before using it. Next, you want to remove the dust cap. This is the cap that is covering the nozzle. If you're using the bottle for the first time, you need to prime it by pumping the spray 10 times until a fine mist-like solution such as this is produced. Next, gently blow your nose to clear the nostrils. Put your forefinger and middle finger either side of the nozzle and your thumb underneath the bottle as demonstrated here. Close one nostril and put the nozzle into the other nostril. Tilt your head forward slightly, keeping the bottle upright. Start to breathe in gently or slowly through your nose, and whilst taking a breath in, squirt a spray of the mist into your nose by pressing down once with your fingers. Breathe out through your mouth, and if you need to do a second spray, repeat the previous step. Obviously, you will want to repeat this for the other nostril if this is indicated. After using the spray, wipe the nozzle clean with a tissue and replace the dust cap. Depending on what your underlying condition is, you might want to use 1 or 2 sprays of the medication in each nostril. Again, follow the specific instructions that have been given to you by your health provider. Now, if you accidentally forget to take the spray at the right time, don't worry. As soon as you remember, take it as usual and then carry on like before. So how do you clean your nasal spray? Well, it's important that you clean your nasal spray regularly, otherwise it might not work properly. To do this, remove the dust cap and gently pull off the nozzle. Wash the nozzle and dust cap in warm water and rinse it under a running tap. Allow them then to air dry. Once they're dry, push the nozzle back onto the bottle and replace the dust cap. In terms of storing this medication, it's important that once opened, the bottle should be used within 2 months and you should store it in a dry and cool place. So how long does it take to work? Well, in some people, they'll begin to feel relief from symptoms within 12 hours of using the medication. For other people, it can take 2 to 3 days. Now, for the best outcomes, don't be tempted to stop using the spray early, even if you feel better. It's always best to complete the course, and if you do want to stop, speak to your health provider first. If you've been using the medication for several months or longer, you should speak to your doctor to ask them to review your symptoms. Finally, what are some of the potential side effects of steroid nasal sprays? Well, like all medications, this medicine can cause side effects, although not everybody gets them. Some people can develop headache, sneezing, nosebleeds, sore throat, ulcers in the nose. And if these are minor, then you can carry on using the spray. But if they become bothersome or you're concerned about them, it's always best to speak to your doctor or pharmacist first. In rare events, some people can have a severe allergy to the spray. This is called an anaphylactic reaction, and whilst rare, it can be life-threatening. If this is the case, you should stop using the spray immediately if you develop a swollen face, tongue or lips, you have trouble swallowing, you develop hives, or you have difficulty breathing. If this is the case, contact emergency services immediately. I hope you found this video useful and informative, and for more specific information, please do see the description box. And until next time, thanks for watching and bye.